So now could you please give me sharing rights?
Yes, I will do that right now. I just had to reclaim them back for a second to start the recording. I'll give them back to you. Thank you.
Oh, it's still saying disabled. Okay, now it's showing. Thank you.
Also, is my voice better now? Are you able to hear me?
Yes.
Perfect, thank you.
Okay, can you see my screen? Great. Okay, so I already did my background. So the focus on the MIT hackathon. Hackathons, I don't know if you guys have heard of them, but it's generally like a couple of days to come up with a solution to a problem. And the problem was, how do we dismantle racism in our healthcare system today, the US healthcare system specifically? So it's hacking racism in healthcare. So the mission of MIT, MIT was the first to kind of launch this. They had other hackathons focused on like medicine or disrupting medicine and disrupting like technology in healthcare, but this was like the emphasis of diversity, health equity, because of everything that was going on in 2020 with COVID. And I mean, as you can see with COVID, the disparities that occurred with COVID were just very, very staggering, and it was just, a lot of people were just really questioning our healthcare system at that time. And so the mission of MIT's Hacking Racism in Healthcare was to create a space for collaboration among those with diverse backgrounds to dismantle racial injustice in healthcare delivery, sorry, and address the social determinants of health. Through various tracks, which I will list later on, they basically hope to shine a light on current structures that propagate racism and implement sustainable solutions to promote racial equity. And then this was an inaugural hackathon focused on that, and it was meant to pave the way for extensive and exhaustive work across all facets of society. And then in order to build a better tomorrow, we begin our work today. So like I mentioned, it was 3 days. It started on Friday, October 16th at 2020 at 6 p.m. I'm so sorry. And sorry, let me just drink water really quick. Okay. So it started at 6 p.m. And at 6 p.m., they basically discussed the mission of the program. I'm so sorry, hold on. I'm like choking here.
Take your time, Calbeth.
Give me a minute. Let me just get water.
Sure, yeah. Has anybody else participated in anything like hackathons before?
This seems super cool.
This is super.
I want to do one now. I don't, yeah, we should maybe, yeah, that sounds fun.
Yeah, maybe. So I'm a data scientist as well. We have a few other data people. I think we maybe get a couple more hands-on programming people, and we could it might be fun to experiment with something.
Okay, sorry guys. Okay, now I'm back. But it took place October 16th. It was on a Friday, 6 p.m. They gave you a question. And the question was like, how do we dismantle racism in healthcare? And then within 6 p.m., everyone came onto a Zoom chat. And then they had like an Excel sheet where you just put down your name and specify which track you want to work on. It could be public health, wellness and health. I think it was also AI technology. And I think there's like 4 or 5 other tracks, which I will name later. But you basically put yourself in a list of a specific track that you're interested in. And then for each track, there's actual other sub questions for it. So I was focused on public health since I have a public health background. And then there's like specific questions, which I will go into later. And then after that, you're in a team with other people with different backgrounds. So there was a team that, like, part of my team, there was an engineer, there was an MD, there's also a teenager. He was 14. He was literally 14. He was so interested in this, and he was also like, his future goals were to become an engineer. So we kind of gave him the option to like just help us build something, even with just a little expertise, a little information that you might have. And so it was really good. But by Sunday, 12 p.m., you had to have been done with your developing whatever solution it was. You had to create a pitch deck, and then you were supposed to present it to a panel of MIT experts. And then they would have a final decision, collaborate, and then make a final decision. And then at 5 p.m., they presented who won. So yeah, this is basically kind of going over that. Okay. So let me just show you like how diverse and inclusive this hackathon was. Let me see. Okay. Okay, can you see my screen? Okay, so age range was so diverse. You had people 18, less than 18, all the way up to like over 55. And then these were all the universities that all participants that or students from different universities that participated. They had an emphasis for historically Black universities because of such staggering disparities that are occurring. And then, like I mentioned, when it comes to HBCUs or historically Black colleges and universities, the emphasis, especially in medicine, is health equity. That's all we know, and that's one of the biggest reasons why I went to Morehouse, because of the emphasis on health equity. And so a lot of participants were part of that. I think I was only one person from actually Morehouse School of Medicine, people in fraternities and sororities, and then like they also incorporate like the National Society of Black Engineers as well, people from that society, and then the race was just staggering. You had everyone literally involved in trying to figure this out. Also places in different parts of the world were participating, Sudan, Saudi Arabia, everywhere, specifically for US healthcare though. So it was really interesting to see other people's perspectives on how they perceive US healthcare in a different country. And then you had, let's see. Kind of paused. Okay, can you see my screen, guys? Sorry. Yes, and then primary backgrounds of people in healthcare, software engineer, business, data analytics, you name it, people are there. So the track there were several different tracks. I'm going to emphasize on public health because that was a track that I was in. And so basically this was the question that was posed, or this is actually the statement. It says that at a public health level, racism is one of the major barriers in eradicating racial inequities and health outcomes. People of color are more likely to suffer from chronic health conditions and infectious diseases compared to their white counterparts. Especially the ongoing COVID pandemic during that time has exposed an alarming level of racial disparities and health outcomes for people of color and minorities. In addition to these conspicuous racial disparities in healthcare, fraying the trust between healthcare providers and Black and Latinx communities. One of the biggest emphasis on this, and this has also changed the trajectory of what moving forward for our app, is the communication and lack of communication between patients of color and physicians and providers. That is one thing that I think our healthcare system today really honestly doesn't, or overshadows, or doesn't really maybe as fully aware of. If there's a communication barrier, or there's trust, lack of trust, then there'll continuously be poor health outcomes. So one of the things that we really need to consider in developing this app is how do we develop and maybe develop a better relationship between providers and patients, and how do we build on that trust? So one of the questions two questions that were posed for this public health track was, how can we develop interventions that dismantle the mechanisms of racism and replace such mechanisms with equitable structures, policies, practices, norms, and values so that the healthy society can be realized without racist and discriminatory policies and practices? And then how might we create innovative options for community support services? How can we create solutions to reduce police involvement in wellness checks and responses to calls? And how might we mitigate the adverse effects of policing on the mental health in Black communities? How can we reestablish the trust between healthcare providers and Black and Latinx communities? So I'm gonna have you, I'm gonna showcase our presentation. You only have 3 minutes to present. So if you were done within, if you didn't finish within 3 minutes, then it was kind of over. So this was our presentation. So I'm gonna show you clips of that for a video. Right here. Can you share? Okay, can you see my screen? Okay, I'm going to play. Let me know if you guys can't hear it.
Please.
Can you hear
Meet
it?
Alyssa. She's a 31-year-old Black woman with pain. She went to her provider that she found through hours of searching in a directory for severe pain, but it's all in your head. She eventually ended up back in the hospital under the care of the same ashamed doctor to get emergency surgery. We should be alarmed that 40% of our first and second year medical students endorse the belief that Black people's skin is thicker than white people's, creating disparities in pain management. Next slide. Next slide, meet Hidden Health, a platform that eliminates discrimination in patient-provider interactions. We put the power in the patient's hands. We choose a provider that best resonates with them. Upon joining, providers will create engaging profiles of themselves, including introductory videos, specialties, research, or even social media channels like YouTube, allowing patients to match with providers by browsing through real people and not just a directory. We incentivize healthcare providers too to gain additional anti-racism and anti-discriminatory learning through gamification on our platform, where once providers participate and successfully complete tasks, they will earn badges on their profiles, signaling to patients their empathy and interpersonal skills. For patients, their racial and ethnic identity will be kept anonymous up to the point where they can choose to share it with a provider in a telehealth session. We can promote anti-discriminatory training like this and also increase patient interest in learning about health outcomes. Next slide, please. Our solution is important and doable because we provide empathetic relationships between patients and providers, and this builds trust. In terms of accessibility, telehealth is currently in a rage and it has a huge growth period, leaving a challenge and an opportunity for us to be a market leader. Anonymity, it also decreases the stress involved with accessing services and builds trust in the system as well. And telehealth is the future. COVID-19 has shown us that this is the way forward in primary diagnosis. Next slide, please. Our consumers are patients that are Black, Indigenous, people of color, or exploited, primary healthcare providers, hospitals, and institutions. In the short term, we will partner with HSBCUs to increase our patient numbers and with majority white universities to bolster and promote educating their teams on anti-racism. So these are our competitors in this space, and our platform is competitive on price, and states are adopting mandatory discrimination training for healthcare professionals, which allows us to be the first telehealth company that uses gamification and incentives to administer education while increasing accessibility to culturally competent care. This is the funding model that we came up with, but we also know that there are other programs like subscription services or government incentives. Last slide. Last slide, please. This is our team. We are from various backgrounds, educations, and ages. We welcome all questions. Hidden Health, we reach invisible communities, so come and find us. And
Okay, so that was our presentation in a nutshell. It was amazing, honestly. And Lily was one of our team members. She pitched it extremely well. And one of the takeaways from that was just learning how to pitch in a very short time frame, but actually making sure that everything's concise and straight to the point. You want to get to the point of your solution and how you're going to solve your problem. And so that was one of the biggest things that we learned during that journey. So like I mentioned, this is our track, public health. And so our problem was focused on racial discrimination and how prevalent it was and rampant in patient provider interactions, and especially in institutions as well. And our solution was to create a patient matching platform where patients can easily find healthcare providers from their own background and get to know the doctors or other healthcare providers better before actually truly becoming patients. So we wanted to do like a telehealth platform for that. So the biggest takeaways was like I mentioned, patient matching in healthcare is a big problem. And one of the things I learned was like in our society today, we have the opportunity to like subscribe to anything that we want, like Netflix. Like we have the right to choose like what like movies we want to watch, or even dating, like what type of dating match that we actually want. But we don't have that in healthcare, and the biggest reason is why. Why do we have to choose? Why do our providers choose us and we are not able to choose our providers? So that was the biggest takeaway from that. Communication barriers. Me as an African American woman, I have a hard time going to providers that don't look like me, just based off of past experiences. And not to say that every provider has to look like me, but there needs to be some type of similarities or things that we can actually like kind of bring together. Like it could be different experiences that we've both learned, or even if a provider wants to get to know me, I would actually truly enjoy that. But that's one of the biggest things that I've seen right now in healthcare. Especially for patients of color, there's a lot of lack of trust, and the lack of trust also increases the risk of a patient not going to the see like primary care services, and then because of that, that ultimately results in poor health outcomes. So based off of that, Hidden Health has now changed into Koi Fish. We did a lot of revamping. So Koi Fish, honestly, very interesting. So three of the co-founders, like me, Calbeth, and then like O was Ogechi, and then Y was Yoma. Lily decided to part ways and then kind of do something else. Now she's working in like menstrual health, which is like amazing. But we decided to kind of take on this journey. So Koi Fish is like a symbolism of like our current healthcare system today. There's, it's very dynamic, it's very complex, just like koi fish. Like they're very bright, they're complex creature or fish in the sea. And then the fish in the sea also represent our patients or providers. They're just swimming in different directions in the pond, and nobody's really getting to that right direction. And with koi fish, our common goal is to bring both patients and providers and give them the opportunity to swim in unison together. Like let's literally work together. So that's the emphasis of Koi Fish. So with Koi Fish, we're here to make healthcare social. And like I mentioned, like right now, especially with the new age generation, they're having it more difficult to maintain long-term relationships with providers, especially in comparison to like romantic relationships. They're looking for providers that have same commonalities and interests with them without being like judgmental. Because right now in our time, like we need to have providers that actually are there to provide care, regardless of sex, orientation, disability, you name it. And so that's what we're looking for right now. But also with our current generation, we need to cater to what is currently happening in their time. And there's social media out there with healthcare, but a lot of the healthcare information is very, very skewed. And also it's not actually truthful. So we want to provide healthcare that's innovative, unique, social media based, but then also giving patients and providers the opportunity to match with each other. So think of us as the Bumble of healthcare. We want to be able to match providers and patients based off of different commonalities, whether it's the same sex, whether it's the same sexual orientation, whether it's actually based off of disability. Like I would love to be with a provider who maybe has gone through endometriosis. I mean, I have personal experience with endometriosis. And so having a provider that has had similar interests with me would be amazing, because they would actually know, like have my lived in experience and be able to cultivate that and develop a relationship with that. So couldn't give you everything, but meet us at the pond, where it's just like literally come and join, partake in what we're currently working on, and see how we can honestly come together to fix and dismantle racism in healthcare.
This is awesome, Calbeth. I'm going to stop recording and we can continue our conversation.